When you apply for Social Security disability benefits, that's actually a two-part program. So when you do qualify for that, it means you have worked and paid into that system for the years that you have been employed and earning wages. Now, for those who are disabled, this is considered a social safety net program through the federal government. So if you are approved for Social Security disability and you have a diagnosis of ALS, you are able to get payments as well as Medicare coverage as a result of your diagnosis. So it's not attached to an age requirement once you are deemed disabled by the Social Security Administration. Once you are approved, they will notify Medicare of your eligibility as somebody who is a recipient of Social Security disability benefits. At that point in time, you will be given information about your enrollment in that program and the options that are available to you for Medicare coverage. Typically, when somebody makes the decision to stop working, we will advise them to go ahead and apply for Social Security disability benefits if they meet the requirements to do so. And so the requirements, they're twofold. One, there are work requirements that have to be met in order for you to qualify. Typically, that's 40 work credits. Typically, that translates to about 10 years of full-time employment, and then employment 5 of the last 10 years before you were disabled. That is the work test requirement. If you meet that, we strongly encourage you to apply as soon as you can after you stop working. You know, ALS is one of the diseases that Social Security has granted an expedited approval for. So regardless of where you are in your disease process, if you're early on in the disease process or far advanced in the disease process, Social Security grants you a presumptive disability just based on the diagnosis alone. Medicare has multiple parts and can be quite confusing. Medicare A, most recipients will get automatically, and that pretty much covers inpatient hospitalization, home health, and hospice benefits. Part B, if you qualify for Social Security disability, you will be given that benefit unless you opt out of that benefit. You will automatically be granted Part B. There is a cost for that is deducted from your Social Security check each month. Part B covers outpatient, doctor visits, medical equipment, most of the medical services that our patients would utilize on a frequent basis. Everything beyond that, Medicare is a little bit like alphabet soup, I tell my patients. There are multiple letters that mean many different things. So beyond Medicare, drug coverage is purchased separately. You will often hear that referred to as a Medicare Part D plan for drug. That is the Medicare drug coverage benefit. It's administered by private insurance plans, and you would need to enroll in that annually. There are also Medicare supplemental plans. Those pay the portion of the cost that Medicare does not pay. So typically Medicare is an 80-20 cost share insurance program. So Medicare covers 80% of the allowable charges, and you're responsible for the remaining 20% of the Medicare allowable charges. Supplemental plans do require a monthly premium to be paid depending on the level of coverage that you choose, but those policies would then pay the 20% that you would be responsible for if you had Medicare A and B only. Plans vary based on your zip code. There are health insurance navigation programs in each state for Medicare recipients. You can usually find these through your local Department of Aging or your state's Insurance Commission office, and they can provide independent guidance and support for the different plans that are available in your area, and good general basic Medicare education about the benefits that are available to you in order for you to make the best enrollment decisions. So when you are approved for Medicare, there are multiple options with regard to how you manage those benefits. Medicare Part C, also called Medicare Advantage, is a program that was established by the federal government to allow private companies to manage your Medicare benefits. And you can electively enroll with any one of the insurance companies that provide Medicare Advantage plans in your state. Those work more like a traditional HMO or PPO type plan that most people are familiar with through their employers. The benefits to those is they can have more benefits by controlling costs within their own provider networks, so that you may pay less for those plans, policies, and services while you are enrolled in that plan. It's more predictable in terms of cost structure. If you know you're paying a $10 copay versus paying 20% of a charge, but you have to use the local hospital versus, any hospital you want, that might be a decision that may be best for a family in order to be able to plan for the cost of care within the budget that they're working with. Or if you can't afford a Medicare supplement, which can be quite costly.